physiology, and this module deals with tanaffus, the respiration. The introduction of respiration has been given to you when you were in the foundation module, if you remember, right? We did all the systems, cardiovascular system, respiratory system, and all that. Okay, so an initial touch was given to you, and we talked about the basic aspects very briefly. Do you remember something about that foundation module at that time? Before we properly start respiration, I would like you to go back and use your stored knowledge which is with you about respiration. I'll ask you a few questions, you try to answer, and then we'll proceed inshallah. Okay? Well, tanaffus, respiration itself is a vital process which is essential for life. We cannot live without this process. But the idea is that why is it important for life, and what happens if we don't have this process? So, answering the first question, why is respiration essential for life? Who can answer the question? Why is it so important? Yes, my dear.
Because it provides essential fuels for life of the life.
All right. So you're saying it is somehow providing essential molecules, some essential ingredients for the body, or something for the body which is necessary, without which body cannot live. What is that essential molecule, my dear? Do you agree with him? Oxygen? The answer is coming in the form of oxygen. Why do you make oxygen as an essential molecule? Why is it so essential for the body? What is the idea? For metabolism of the body. And what role oxygen is playing in metabolism, by the way? Okay, that's a key word which is coming up here. I heard the word energy, someone said. Okay, so do you all agree? Oxygen, if it is there, energy will be made in the body. You can make energy. Shabab, without energy, none of our cell can live. All the time, you need a constant supply of energy to make life possible. If life is there, it has to be supported by energy. That energy is coming in a very special form. Can you name that form of energy? ATP is the very easy answer. It means oxygen is giving you ATP production, and ATP is stored in the body, in the cells, and then that ATP is used. Of course, ATP is used and it finishes up. So you have to make it continuously all the time. That's why you need a constant source of oxygen all the time. Throughout our lives, as long as we are living, we need oxygen, we need ATP. This ATP is going and utilized, oxygen is coming and making new ATP by a special metabolic process inside the cells. You know that. This is how respiration is essential for us. That is one thing. The second thing is that if we don't have respiration, one thing, energy will not be there and cells cannot live. What else will happen in the body, or what other abnormality is there which disturbs the life? What do you think?
Accumulation of toxic materials.
Accumulation of some toxic materials. And may I connect your answer with the other one who is saying acidosis here? Okay, one person is using acidosis and you're talking about the toxic metabolites or the toxic substances which are accumulating. Well, I think when you say toxic metabolites, you are going for a very special gas which is produced all the time in the body. Just like oxygen is used, another gas is produced, and that's CO2. And when you are saying acidosis, what is your idea of saying acidosis?
Because the accumulation of CO2 leads to acidosis.
Okay, that's a very important link. CO2 and acidosis. Do we agree with that?
Yes.
How is CO2 responsible for acidosis? Yes. And then? Okay, carbonic acid. Now we are reaching another word, carbonic acid. Carbon dioxide has the property to make carbonic acid. And that carbonic acid, as the name indicates, is an acid. If something is an acid, it will give off a special ion. What is that ion? Hydrogen ion. So by carbon dioxide, you are making hydrogen ions. And this process is going by tanaffus. If you are removing the carbon dioxide, you are maintaining CO2 in the body at a lower level. If you don't maintain your tanaffus, then your carbon dioxide, which is produced by cells all the time, it will gradually build up in your tissues, it will fill up in your blood, it will be converted into carbonic acid and thence into hydrogen ions. And H ions, will be responsible for the consequences of acidosis. They are damaging ions and they can destroy the tissues. The most vital is the control, and the control is depressed. If the control is depressed, everything is gone. Okay, so acidosis will lead to coma, and obviously if you don't treat that, okay, it is the end point or moth. So in different ways, in terms of energy and in terms of keeping your acid-base balance also in the body, you rely on tanaffus. Tanaffus is such an important act. Okay, this is our knowledge about it. Of course, we have a very special system, and that system is known as the respiratory system. Anatomy has been given to you. Have you talked about the anatomy?
Yes.
That's good. Okay. Mashallah, from before also you had some idea about the anatomy of respiratory system. Now you have done it in a detail also, because you are talking about anatomy and histology. So you are going into the structures in detail, so you will understand the processes very easily. Very well, inshallah. Okay. Now, there are multiple steps when you talk about respiration, but before going into those details of physiology, again, I would like you as a class, as a group, to give me some idea about the disorders which you have come across in your life, which you have seen in your families, in your friends, around people, community. One answer has already arrived, and that's rabo or asthma, right? Bronchial asthma is one of the disease. Are we all familiar with the name of this disease? Bronchial asthma? Okay, a typical process in which you see the person in a difficult situation, that he has a labored breathing and it's not easy for him. Okay, and he may have cough also, and he is in distress. He is unable to carry out tanaffus easily. There is a problem really. Okay, and that problem is caused by a respiratory system. Something is happening inside. Okay. In asthma, what is the main issue? What happens to the system? Yeah. Narrowing of what? Okay. Narrowing of your alveoli or narrowing of your bronchi and bronchioles? Bronchi and bronchioles. All right. And do you think it is narrowing of your larynx and the trachea? No. We don't think so really. Okay, it means you have a concept that some areas which are going smaller and smaller, the smaller divisions, they have some structure by which you can make them narrow. What is that structure mawjood there? Now I am receiving two things. I am receiving one information in the form of cartilage and one information in the form of smooth muscles. Okay, so which one out of these two is actually controlling the caliber or the size? Okay, by contraction, smooth muscles. If cartilage is there in that area, do you think it is easy for the tube to become small, or cartilage will oppose that? It's opposition. That's why when you go up in the larger areas or the larger airways where cartilages are mawjood, you will see that the true constriction does not occur, isn't it? So asthma is a disease, one disease. Is it an infection, basically? No, not primarily an infection. It may be accompanied by the infection later.
Autoimmune?
Okay. Asthma is autoimmune. Okay. Or, all right. Allergic We are having different etiologies coming: autoimmune, infection, allergic. Any other word can we add here in this situation? Hypersensitivity, allergy. I'm grouping it in the same as you were saying, allergic. Okay. What else? Congenital, by birth time. Okay. What else? Can you think of any other pathology?
Degeneration.
Degeneration due to what? What process of degeneration if it is going inside? Damage. One, inflammation is the word. Like you are using infection or inflammation or allergy. Okay, these are the different forms which we study in pathology. Out of this, if you want to make a choice, what choices or what choice will you make for asthma? Just an idea. Inflammatory disorder? It is inflammatory. Along with that, is it allergic disorder also or hypersensitivity? So it's a combination of a hypersensitivity state and the the inflammatory state. Okay, so it is hypersensitivity accompanied by inflammation. Both etiologies are present in the asthma. This is one disease. Can we name any other disease of the system?
Bronchitis.
Bronchitis. As you're saying itis, what do you mean by that? Okay. All right. Bronchitis. Okay. Good. What else? Pneumonia. That's a very good word coming up, and it's a very common word that we hear. Pneumonia. What do we mean by that? Inflammation. If it is inflammation and you want to change it to the word inflammation, how can you change pneumonia? Pneumonia. Now you convert this word as it is showing you inflammation. Change the name. Yeah, so it will become pneumonitis. You can call it pneumonitis or you can call it pneumonia. Okay? Because when you are saying pneumonia, you are not getting the idea of inflammation. It is inflammation definitely. Okay? It is an inflammation process due to infection. Awwal there is infection, and later that infection leads to damage and inflammation is there. Okay? So this is pneumonia. That's a good one really. A very common disorder. What else? Emphysema. Emphysema. Are we comfortable with this word, emphysema? Emphysema. Yeah, Shabab. Who is there to tell me what is emphysema?
Dilation of the
Alveoli. Sac-like structures. Large areas, terminal portions of your respiratory airways. You know that. Something wrong going with the alveolar region. He's saying they become kind of dilated or bigger in size. Do you think there is some destruction in that region which is making them big?
The degeneration of intra-alveoli system.
Okay, that's a very nice addition. One of our students is adding that it's a damage of the septa, the walls of the alveoli. Alveoli are attached to each other, supported by each other. Their walls are common really, many alveoli. If you damage the common walls, then the small alveoli will not be there, but a large kind of sac is formed because many alveoli are destroyed and the area becomes like a balloon, like a big area, a dilated area, okay? And it is due to destruction of the alveolar septa. So the walls are getting damaged or degenerated by a special process of inflammation. Okay, again it's happening there, and this is known as the emphysema. This is one of the diseases. It's a very special type of disease in which also there is some problem in the air movement. The air cannot move properly in the respiratory system. Air is moving by inspiration or it is moving by expiration. What do you think in emphysema? Is it the problem of inspiration or mainly a problem of expiration? Expiration. So you have a good idea. Some obstruction is happening. That's why this disease is also known as obstructive lung disease. Emphysema is obstruction. You are dilating, But you will see inshallah in pathology that there is obstruction to the outflow and the air is not going out. That's a good one. Any other disease, my dear? Yeah. Tuberculosis. I'm sure all of us know about tuberculosis. Is it an infection? Yeah, thank you very much. It is an infection. What else? Collapse. Sometimes lungs which are filled with the air all the time, whatever we do. Once we are born. Yeah, that's a good one. If you go back before we start our life in this world, I'm talking about fetal life. Go back. Do you think lungs are filled with air at that time? No. Once we are born, we take our first breath of life. Our lungs become okay. As the baby comes out and take a gasp and start crying, due to that gasping and crying, the air goes inside the lungs and they are filled now. Okay? And then as long as we are living, our lungs never are empty of the air completely. The air can decrease, air can increase, okay, but all the time air is mawjood in the lungs, you know that, okay? In disease states, sometimes the lungs are damaged or there is some problem in the lungs due to which one portion or a complete lung can be, one part, little part, or a lobe of lung or a complete lung can be collapsed, or the air is moved out as if it is like punctured and air has been released and it becomes like a solid tissue. Okay? It is not a solid tissue, it is an air-filled tissue all the time. But sometimes in diseases, collapse can happen and that is known as the lung collapse. We'll talk about that also. That's another disease. Thank you very much. Any other disease that we know of?
Respiratory distress syndrome.
Respiratory distress syndrome is again a problem which can happen in Maulud or which can happen in adults due to some reason, and it is somehow associated with the collapse of some areas of the lungs. Okay, we'll go into that disease also. Any other thing? Yeah? Edema. Pulmonary edema. Do we understand the meaning of the pulmonary edema? Yes. Good, great. We know edema and we know pulmonary. Okay, very nice. Coming up. What else?
Cystic fibrosis.
Cystic fibrosis, we are receiving the names and I'm impressed really that you know about the pathology. You are using the word fibrosis here, isn't it? Yes. A cystic type of fibrosis. Is it developing in an adult person like us, or is it a disease which is coming as a genetic disorder? What do you think? Genetic. So it is presented from the childhood usually. Okay, is it? So there is fibrosis of the lungs. If there is fibrosis of the lungs, lungs develops fibrosis inside, more fibrous tissue, more collagen is going. What will happen to the lung? What problem will be there? More fibrous tissue. So what will happen? Less capacity. The capacity of the lung will decrease. Why? Because fibrous tissue, when it develops, it does not have the elasticity. Okay, you know, normal lungs are very elastic like a balloon and they can become bigger in size and then become smaller and bigger and smaller. But if fibrous tissue is developing, the fibrous tissue is changing the elastic tissue into the collagenous material, so it cannot stretch properly. So the size of the lungs or inside of the lungs will decrease. So the volume or the content will also be decreased. That's a very good concept. Thank you very much. So now we have talked about the fibrotic diseases, obstructive diseases, inflammatory diseases, infectious diseases, allergic disorders, and some genetic disorders. At least some examples have been given. So we are just brushing up our memories and a good stuff has come out really. Okay. Thank you very much. That's a very nice response from you. And with that response, let us begin. And now we go back to the basics, please. Okay? We are using the term respiration. Okay? First of all, before I start this slide, I would like you to again answer what is respiration? Respiration. But I want your attention first of all of you. All of you are not attentive right now. Some of you are not attentive right now. Okay, you are still with your mobiles. If you are with the mobiles, then we cannot interact really. Okay, so please, I want your attention for a short time. And because the lecture will finish in 12 minutes, inshallah. Okay, the first part of the lecture will finish, and then we'll carry on in the second one. Yeah, respiration. This is just a beginning, ibtada of the lecture. Respiration. Yeah, I need the answer from you. Okay, a process which is having, again we are brushing our core knowledge. What do we know about the word respiration? He's saying, well, it is a process which has phases like inspiration, respiration. Okay, I'm keeping that information. What else? Gas exchange. Well, it is something which is related to the gas exchange in the lungs. In the lungs? Yeah, gas exchange in the lungs is also happening in a part of respiration. Okay, what else? You are conducting the air by the process of inspiration or expiration. Yes. All right, this is also another addition. What else? A process which is giving us the result of respiration is energy, right? If you are going towards the end result, it will give you energy. Okay, what else? And the other result is to balance or maintain the acids and bases in the body. All right. So let's gather all the information together and develop a definition of respiration. Tanaffus. Okay, I'm talking about respiration. Do you have any other word for tanaffus instead of tanaffus for respiration in Arabic? Or tanaffus is a good word. Okay, this act of tanaffus is respiration, you know. Okay, now I'll start from here. The exchange of the gases between the exchange of gases. I'm going for a broader definition. I'm not going only for the lungs. Yes, gas exchange is mainly happening in the lungs as we see. Okay, but yeah, but you know, exchange is also happening at other levels of the body also, isn't it? If you go to the tissue level where you are giving oxygen and you are taking the carbon dioxide, it means exchange is also happening in the tissues. Exchange is also happening in the lungs, isn't it? So now we turn our definition and we make it broad. We call it respiration is the exchange of gases. When I say gases, I mean, you know that, okay, you know, between atmosphere, outside atmosphere and the body. Bas khalas, that's it. Hold it. When you say the word body, you involve all the levels of the body. You are talking about all levels of the body. You are not specifying whether you are talking about only lungs or tissues together or what. This finishes the definition. Simple definition which is enclosing a complete information. So respiration is a process which is the exchange of gases, gaseous exchange between atmosphere and the body, and this covers all the processes and conduction also. Okay, now let us divide this respiration very quickly. I'm going slowly for the introductory lecture, but I want your concepts to come up as you had in the previous foundation module. Okay, once you are in flow, we'll go quickly, inshallah. Okay, so the first process is called internal respiration. Again, we are dividing now this respiration into two parts. I'm using the word external respiration and I'm using the word internal respiration. Okay, please. Now this whole respiration between outside and all levels of your body, now you are dividing it for better understanding into two levels. One is external and the second one is internal. Yes. External respiration, let's catch it first. What is external respiration, Shabab? Yeah. External respiration, I'd like you at the back side. External respiration, we are talking about that. Okay, are you with us? Sure? Okay, if you are saying so. External respiration, yeah. Exchange between atmosphere and blood, you are saying. So you are starting from atmosphere and you are keeping yourselves up to the level of blood. You say, khalas, this part of respiration is external respiration. Everybody agrees with this definition? No disagreement? All of you? Who disagree? You disagree. If you disagree, what is your opinion about it? Yeah.
The external gas exchange between the atmosphere and to the upper respiratory tract, mouth and nose.
Okay.
And the internal is between the blood and the alveoli.
So there is one point of disagreement. We are not still 100% sure. All of us are not agreeing. He's saying no, make it a little up. Okay, when it is entering here, going into the lungs and coming out, and from the blood, internal is starting. He's saying that after blood. You are saying that till blood, you are considering everything as internal. Any third point or disagreement here?
The external is between the atmosphere and the blood, and the internal is between blood and cells.
Okay. Abdullah is saying that when you're talking about the exchange between the blood and the tissue and the cells, that area is known as internal. Before that, it is external. Okay? We are coming with a different concept. Yes, my dear.
External means exchange of gas between two areas, blood or cells, air or lung, atmosphere or lung, and so on. That's external. Internal, inside the cells where it makes energy.
Okay, so he's saying that, he's adding another concept. Now the fourth concept is coming up. He's saying that external means you are not talking about something outside the body only. You are saying that internal or external is according to the cell. Your reference point is cell actually. If you are doing something inside the cell, if your respiration is going on inside the cell, you will call it internal, and before that it is external. Yani when your gases are coming inside the system and they are going into the lungs, and then they are going into the blood, and then they are from the blood going into the tissues, yani interstitial spaces, and from interstitium it is going into the cell, yani oxygen is going into the cell, and carbon dioxide is coming out of the cell, and then you are coming and taking it in the blood, and it is coming to the lungs, and it is coming outside. Yani from outside you are completing the journey to the inside of the cell. You are taking oxygen from outside and you are leaving that oxygen into the cell. From the cell you are picking the carbon dioxide, you are taking it into the blood, and you are throwing it outside into the atmosphere. He is saying that this whole tawil process is external, and internal means it's a very private respiration. It's a very private respiration of the cell itself, in which metabolism is occurring probably. Are you saying that? Yani oxygen is used by the cell and carbon dioxide is produced by the cell. He's saying that. Out of these four definitions, now after discussion, what do you think, which definition fulfills our concept of external respiration? What do you think? Out of these four, if we have a choice. Is one? Now some of us are changing the concept and we're saying no, external is actually a very tawil process, okay? So don't get confused. Thank you very much. I agree with you, and the class also agrees with you. Your answers are coming. Your answers are a part of external respiration, but complete external respiration means everything which is happening between atmosphere and entry of gas into your cell and coming of the gas outside your cell. Everything there in the body is external respiration. Internal respiration is happening inside the cell. Okay? It means you are using oxygen in metabolism and you are producing carbon dioxide bus. That part is known as internal respiration. Okay? You got the point? So internal is the cellular respiration, and the rest of it, the remaining part of your journey, is known as the external respiration. That's a good one. Now we are clear about the meanings of the external and internal. Are we all clear about that? No confusion? So this is one basic concept which has to be corrected when we are starting. Okay? Internal respiration, now look at the definition. Intracellular mechanisms when oxygen is used and carbon dioxide is produced. Okay? External respiration, all the other steps. Your movement from atmosphere into the lungs, from lungs into the blood, from blood it is carried and transported to the tissues, and from the blood now it is going into the cells. This is external respiration. Carbon dioxide from the tissues coming out into the blood. From the blood, it is coming into the lungs. From the lungs, it is going outside in the atmosphere. And now this completes your external respiration. All right? This whole process, you can see that. Okay? So, in this diagram, if you identify external respiration is starting from there, isn't it? And till this level, you have the external respiration. Do you agree with me? All right? Only the inside story, the metabolic story which is happening inside, that part is known as the internal respiration. Okay? That's it. Okay. Now, identify the steps, please. Now look at the names of the steps. External respiration is a tawil process. Okay? It has many steps. A multi-step process, one by one. Look at the process number 1 which is happening. Can you identify the first process? It's ventilation. We are using a special word. What do you call that word as? Ventilation. Okay? The second word which is we are using here, it is gaseous exchange at the level of the lungs. Isn't it? Third step is now you have to take oxygen in the blood, carrying of oxygen and the carrying of carbon dioxide also in the blood. This is the step 3. And the fourth step, or the final one, is exchange between the blood and the tissues. So you are systematically describing 4 levels of your external respiration one by one. With tartib it's coming. The first one is ventilation.